Good morning.
Hello,
I haven't been
everybody.
on here in like 6 weeks.
It's been a while. I'm
Maybe
here
not that
sporadically,
long.
but it's been a while since I've seen you.
I
We addressed
know.
that. It's just like, I have a baby now. She's
I,
like, what?
he has a baby. He has a baby.
Yeah, baby number 2. I said, he's a pukey
So
boy, but
exciting.
he's
And
here.
we discussed he and his wife are going to stop eating cheese.
No.
And
No, Boone's going to have
and
to
it,
puke. And he's going to have to deal with
and
it.
it will fix everything.
Cheese over baby puke all day, every day. Like, so my boy, he's a pukey guy, and it's just not going so well. But he's
It's all just
tracking.
a phase. Everything's a phase with kids,
He's in the
It's a pukey phase.
seventh percentile in weight.
Oh,
He's
okay.
a tiny little guy.
Oh, he is tiny.
My little bean guy.
Oh,
But he's a good boy.
good.
So that's the good energy.
That's the good.
Now let's yin and yang into our kind of first topic is how we're dealing. Now, 6 days past, something like that, the deadline for Humana's commissions.
Yeah.
So now we're down to like one carrier in the universe paying commissions
Yep.
on prescription drug plans.
It's fun.
It's fun.
It's really fun.
How you feel, Kari?
I feel I will start with a positive
Let's do it.
because I will say my clients are just as mad as me.
Oh, really?
Yes.
Like they're feeling like
They're feeling very, because like I can't even, like some plans, we can still do the actual enrollment for, but like
Mhm.
if they want Humana, you literally
Oh.
can't.
Okay.
And they're like, are you kidding? I have to go to the site and do this myself? And they're like, I had one client yesterday. She was like, well, we have a house in Maryland. Can I say I live in Maryland? Can you do this if I say I live in Maryland?
just like any way they can try to get you paid.
No, I can't. So
I love
like
the effort though.
I've had several clients that are like, this is ridiculous. You can still help with medical, right? Like this is just a drug plan. Is this going to change? Is it permanent? Like they are
So they're kinda
very
freaking
unhappy.
out.
Yes.
Because they're like, what if I have to do this for everything and then
Yes.
you don't exist to me
For sure.
anymore?
So that's been reassuring with how mad they have been. But it's just, I think the word I have is defeating.
Yeah.
Because it's just like, I wake up at 4 every morning and I work for a few hours before the kids wake up, and I'm like, everything I'm doing is for free.
Like this is fine. It's all
This is
fine.
fine. I'm
She
getting
carries the
5
beat
hours
right
of
now.
sleep because I'm working for free.
Yeah.
So it's,
I
mean,
don't have
you
a good spin on
you
that.
just
It's like,
have
yeah,
to
I'm
do
just here
it.
for you,
You
Kari.
just have to do it. Like you just have to buck up and do it.
Yeah.
And I think the way I'm also handling it is email is my preferred means of communication.
Yeah,
If I
quick,
can
easy.
keep you from coming in and wasting my time, it's still worth
not
your
a
time.
waste,
It's not a
but it's
waste, but waste of my
$0 for your time.
yes. Then I'm gonna do it by phone and email if possible.
Yeah.
And
Well-
that's gone over well so far.
That's good. So are you kind of framing it as like, I'm still helping you do this because I want your MedSup business or your referral business to the next MedSup person? Like, what's your why behind still doing it? Because I know a lot of agents right now are struggling with like, why am I even still doing this?
You mean like what's my why to you, or like what am I telling? Like how am I phrasing it to the client?
A little bit of both.
A little bit
Tell
of
me
both.
first. Tell me why you're still doing it.
I mean, I'm still doing it because I don't know how I could look at my clients and say, you're on your own for this. Like, I just feel like that is terrible business.
Yeah.
And because drugs are so important to them that
Yeah.
like it's not even a second thought. Like I'm just doing it.
It's just the
I'm
big
just
heart
gonna
and
do it.
Kari kicking in.
Yeah.
It's like,
I
no,
mean,
I can't let you walk away.
just sucks, and it is what it is. But like my clients don't know any different until like they come in for their review, or they get an email from me saying, hey, I reviewed your drug plans. These are the top 3 plans. And I don't say anything about commissions yet. And then they're like, okay, well, let's go with WellCare. And I'll say, okay, well, I can do that one. But if they're like, well, I want to go with Humana. Okay, well, let me tell you, you have to do this enrollment. What? I don't want to do it. And so I'm not phrasing it from the get-go any differently.
Yeah.
Just kind of on the back end,
It's like
depending
when
on.
you get to the carrier. It's
Yes,
like
when I
if
get to the
you can do
carrier.
it or not. Okay.
And
like
I have
that.
had some people that, just a guy yesterday, he was like, oh, $200 for the health spring. He was like, absolutely. If you can do that, like, just sign me up.
That's nice. But
So
it's like people are like understanding and wanting to keep you
yes.
in the loop or in the fray where you're
hmm
like, you're still getting commission for this,
I
right?
think you just have to be frank. Like if you're not being frank about it, I don't know what you're doing, because like you have to just say, I can't sign you up for this. They're not allowing me to service this plan. They're not allowing me to do the enrollment.
Yeah. So, okay, then as like a business owner, a mom, as a family person that's like struggling with, you used to get paid on this.
hmm
Now you're not.
Yep.
What are you doing now? Like,
What
do
am
you
I
just
doing now?
are you taking the hit? Are you looking at ways to expand with your time?
I I haven't really thought that far. I made a new deadline for me to get all my PDP reviews done by November 8th.
Okay. So you kind of shrunk your window of
So,
time. You're like,
yes.
okay, well, I don't want to be doing this as often.
And so I tried to get everything done by November 8th to make sure that like if I was going to get paid on something, I was like the Humana plan,
Yeah.
that I would still get it. And I got like 90% of them
Nice.
done.
Okay.
So, I don't think financially it will hit me as much, because so much of my book of business last year was WellCare and they didn't pay.
Already. Yeah.
So, I honestly am wondering, like, am I going to actually have an increase in PDP because I have done so much to Humana?
Yeah. You're like, I might see a small bump here.
Right. I don't know. It because I am so MedSup heavy in PDP, like I don't have a huge Advantage book. I'm sure it will affect me, and it just means I have to get more new clients.
Yeah. So just kind of focusing on, okay, let me speed up this process so I have more time for insert in either another training that you do, another meetings that you're doing, another referral
Just
client that comes in.
prospecting and more time with my network partners. I did 3 seminars last week and I was so mad about it. I'm like, I shouldn't be mad. These are great opportunities, but why did I schedule these in November?
Well, you kind of knew what was going on with this, right? You're
I
like,
know.
I have to try to get new folks this year.
Well, and this one group I was so excited to get in front of. It was the Missouri HR Association.
Okay. Yeah, that's pretty good.
So
right?
I was in front of like 30 HR benefits directors
Sweet.
from all over the state.
No, Alex will talk to you about it later.
And
you're fine. Go ahead.
And like I have my bread and butter with all my like financial advisors, but there's so many times I'm just like, you know what, these employers need to know about these HR benefits, because their employees are coming to them when they retire, you know. And so I was just really excited to meet with that group.
So from what I'm hearing is like you're literally just looking at, I have to make this work in a less amount of time.
You just have to make
then
it
have more time over here to
for sure.
make everything
You just
work.
have to make it work, and at least that's the way I look at it, because you're going to lose clients. Like if you don't service their PDPs, you'll lose business. I really think
somebody will do it for
somebody
free.
yeah somebody will do
to
it
try
for free.
to take or to do it for free.
To try
and
to take the
other.
supplement.
Yeah. And that's what you're there for. I mean, that's
Absolutely.
The small PDP commission's not really
Yeah.
doing anything for you, but you're like, I
'Cause
want those
also,
renewals. I
like-
want that referral that you're going to give me.
I'm also trying to rephrase my mind of like, all right, if I sign somebody up for a MedSup, like there's zero maintenance. Like they're not calling because they got a denial or a network issue. Like it's just easy peasy
Super
throughout
fair.
the year. So like my work is their PDP. It's not on the supplement plan.
I think that is the message and the feeling that like if we could all grasp. I
Yeah.
say we like I'm writing business. I'm not. I'm just talking to you guys as a guy with a mustache that looks silly on camera
It
right
looks
now.
great.
Okay,
I meant to comment.
Thank
No,
you.
mustaches are in.
Not this one. Not this one. This is a Movember mustache that it hit
You're
hard
rocking it.
this year. Let me go back. I'm gonna come back to the
'Kay.
mustache talk at some point. But the zero maintenance on
Yeah,
the MedSub
It is for sure.
is
I mean,
thinking about it that way of like, this is my work for them. Because you know your MA clients are going to be more of a headache throughout the
Yeah.
year when they're having provider
like
issues.
my MedSup clients, we talk maybe once a year.
And is that
so
PDP season?
It's PDP season, or it's, hey,
Their rate
I got a rate
increase.
increase in June. And so, you know, it's
And that, I mean, that was something we wanted to talk about too, was just like, okay,
yeah.
yep, here they come again.
Yep, they're going up. I mean, I'm talking a lot about plan Ns and high deductible. I have sold so many high deductible Gs lately.
Ooh, look at
Um,
you.
I have. Well,
I
like
love Carrie. Like, me and Carrie don't get to catch up like ever except
ever.
here.
Yeah. You're catching us live. It's
Tell
just
me about it.
well,
Dish girl.
plan Gs have just gone so high, and I
Mhm.
just feel like if somebody, if money's not a factor, I think everybody would have a plan G, but
Yeah.
when you're retired and on a fixed income, money is a factor. But if you really want the like no network, no prior authorization, and like the simplicity of traditional Medicare, a high deductible G is such a good way to save a lot of monthly premiums. And I'm so excited. This is going to get kind of long. But
Mm-mm.
I
Love
had
it. Go,
I had
go.
somebody for the last 3 years, she has been on a high deductible G. She's super healthy, but she was really torn which way to go 3 years ago. And so her first 2 years in the business or on Medicare, not in the
In the
business.
business. In your
Her in
business.
my business, she just saw her like primary care once a year, so she didn't really use it. Well, this year, her review we had a couple weeks ago, she brought in everything and she goes, I want to know if I still made the right choice. She had 2 surgeries and 12 doctor's visits since January.
Mm-hmm.
She hadn't even met her deductible yet.
Sweet.
And she had been
What?
saving, yes.
2 surgeries?
2 surgeries, 12 doctor's visits.
Bonkers.
Because remember, like the high deductible G, you're paying after Medicare has already paid
Yeah.
80%. So like her bills she was getting were like $50 and $200. So like she had just paid a little over $1,000
I think
and
I'm
didn't even come
skewed
close
from the
to
group
that.
world. I'm like, I
Right.
have
A lot of
surgery.
people,
Boom,
exactly.
deductible.
And that's how I rephrase it. I'm like, okay, you're going to have to rethink everything you know about a deductible because usually deductible means you're paying everything until
Yeah.
you met that deductible. But really, you're only paying 20% until you've met that deductible.
I don't think about it that way.
Yeah.
But
And
thank
so
you for phrasing it.
I've had a lot of people do high deductible Gs.
Okay. All right. Here's the Clayton challenge that you know is going to come.
Yes.
So they go to the doctor and they're like, or they go to the doctor and they're like, ooh, we need to admit you to the hospital.
Mm-hmm.
What product helps that?
A hospital indemnity
Does it?
plan.
Do you do that? She's gonna. I'm gonna make Carrie. She's gonna sell one and be like, Clayton, I did it.
Hey, I have like
Do another one.
5 or 6 on the books.
You know,
Maybe
that
more?
5 or 6 just replaced 26, 25-ish of your PDPs. That
That's a
commission.
lot.
So, Carrie, challenge time.
Uh-huh.
She says, she gives you all those things, and you're like, you made the right call.
Mm-hmm.
The only thing I'm concerned about is if you were to get admitted, then we hit that really quick.
Mm-hmm.
I have this.
I have this. You know what?
If you want it,
Light bulbs are
let's
going
talk
off
about
right
it.
now.
It's there, and we run away. If
We
she
were
says
meant
no,
to do this today, Clayton.
I know.
We were meant
This
to be
is
together
good.
today.
I'm so happy. This is what I have with agents is the like brief challenge time of just like I'm gonna push you to be
Follow up with
one
me.
step better.
Follow up with me, okay?
Because Carrie's amazing, guy.
No.
Like, and like I'm just gonna constantly like, this is what I do. Like, the agent that's just like they're humming along doing their thing. I'm gonna keep them prospecting and keep them doing.
Do it. You need to do that, and you need to follow up with me.
You're beyond that. I
No!
need to take you. I know you're gonna do that stuff. I know you are, and I'm gonna be like, so you have one client that did this. Anyway, did you do
Anyways.
this?
And that's why you're so great at your job.
A little bit. I don't stop. No, so like that's just something I've been talking about a lot with like the high deductible plans.
Mm-hmm.
But like it did just change my thought process a bit, thinking about like I'm like, no, you hit the deductible if you have surgery, like immediately.
Yeah. Right.
But not thinking that Medicare is picking up
up
80%
first.
of that.
If it's an outpatient surgery.
Yeah.
Which hers were, she had like 2
But if they get admitted,
retina surgeries or something.
What if they get admitted, Carrie?
Mm-hmm. then
hospital indemnity.
then they're going to have a hospital indemnity plan, which I will
I'm
turn
the
back around and
worst.
sell them in January.
That's good. So like that's honestly like the conversation I've been having is like the high deductible G plans of just like, look, you saved them so much
Yeah.
money here. It's because a lot of people are switching like from like a plan G or plan F or something.
Right. Somebody yesterday
Huge
saved
premium changes.
$202 a month.
$202. Okay, so we just cleared up $202. Slide them over like a $30 hospital indemnity. They're so well protected. It's like the best thing opposed to like getting on an MA plan that's like, oh, cool, you can go to these certain doctors because HMOs are the thing now.
Yeah.
And you have to do prior authorizations and all this
Are
stuff.
people, do we know if a lot of people are actually switching to HMOs?
I think they're getting forced to.
Well,
it's like because like a lot of plans just went away for the PPOs.
but there's still some PPOs out there.
Yeah.
Like,
no,
is this initiative to like steer people to HMOs? Like, is it flopping?
No, I don't believe so. Danged. Right.
Answer again.
No.
Is it flopping?
It's
Try answering
it's
number 2.
gonna trend more and more. I think they haven't won the battle
PPOs
yet.
won't be going away though, is what I'm gonna tell myself. They just might have premiums.
They might have premiums and they might not pay you.
Okay.
And they might make you do a
solid.
paper app if you want to do it. Yep.
What?
Yeah. So because it costs the carriers an insane amount of money to use these PPO networks that clients really aren't using. I saw some statistic. This is more of a Chalin brain than my brain. My brain has a mustache on it, and Chalin's doesn't. So there's some statistic out there that's how often those PPO clients are actually using that PPO network based instead of like what would be on that same thing for an HMO. And it's like they just want the flexibility or the peace of mind that they could.
For sure.
no
But that
one's
peace
using
of
it.
mind means a lot to people.
It does, and it costs the carriers a ton.
I've
that's
got
why they're
a lot of
pushing
clients
back
on
on it.
on a Advantage plan that travel.
Yeah. Well, like that's the thing is like there's still going to be I think those passport plans and a lot of those where it's like yeah, you can go to this HMO network in this other area or in this area, but like the days of just get to go anywhere that UHC is available are dwindling, I think.
Man.
They're shedding membership where they want to.
We'll let's save that for another day, you know?
She's like, you know what? I hate your mustache.
Another day.
Go back to the other thing. It was fun.
Oh gosh, I'm just kidding. I didn't mean to shush you.
No.
Michelle
I deserve a
says,
shush.
what do we have here? I have both the PPO and sub movement to HMOs.
Yeah.
Yeah, I don't have a big enough Advantage book to know.
If I'm looking
like,
at
what's
SARs,
trending.
like service area reductions,
right.
it's massively
To
PPOs. So they're just getting rid of the plan.
Oh, okay, right.
They're just gonna be like, no,
Yeah.
we can't service that area, or like they're shedding the like rural communities and being like, you have one hospital that's close to you.
Yeah.
Use our HMO.
But there's like in Kansas City, I have a ton of people who like or have switched to the Humana PPO. Like why would Humana make this new fancy awesome PPO if it's going away next year?
Remember when Aetna did the fancy like I don't know this. This is me just
do I want to hear that?
Aliens. Hang with me.
Okay.
Remember when Aetna said you can have new shoes, you can have a camping kit.
Yeah.
Sometimes you just need some business, and you're getting some business on the books.
Okay. Humana's got to be number one now.
Humana is doing real good
like
this year.
they've got to be number one.
It depends on the market, but I mean UHC just by volume is going to be UHC. I wouldn't be shocked if they're still in the top 3.
Yeah.
With a down year for them, but Humana, for like the agents that I'm working with, Humana is one of the top carriers. Yeah. Basically anywhere I'm looking. For sure. Devoted's doing really well. Yeah. Essence in their pockets are doing well. Silencio. Phone vibrate. So like I think the PPOs is like they want to be the landing spot for PPO. Like they're trying to win a network, win an area. I just don't know how long they'll be able to hold it. Right. I mean, they could do so well with all their HMO business that the loss ratios work out like behind the scenes that they're like, well, yeah, we can take this. We can take it. But that's where carriers are running into.
Time will tell.
Yeah, it really is. It's just like PPOs probably won't go away. It's just going to be harder to write them. Like, do you have to do a paper app?
Right.
Do you get paid on it?
Yeah. Let's just keep taking those away.
Yeah, they're just going to make it harder and harder.
What's the ACA update that you have?
Ooh, so government is back.
We're back.
They do things again. So good for them. So we'll leave that there. And then there's still no solution for ACA subsidies because they just got back. And it's like, you know, when you first get back to school and you don't really do anything for a while, maybe they're at that point.
Okay.
And so, like,
that's good. Yeah.
Let's work on that solution, y'all, because some people are out there struggling, and ACA plans are garbaggio. And I'm bilingual today, apparently. So they're real bad, and a lot of people are looking for alternatives because, like, ACA is all they've got an option for because they've got pre-existing conditions.
Yeah.
So they're looking at crazy payments or just honestly like horrible coverage that they're like, if they go to the doctor, they're not getting that like couple $1,000 bill.
Right.
Way on their max out of pocket side. And so like we have agents asking us all the time, like, what's an alternative to this? And the only thing that I'm seeing that's like beneficial is like a short-term medical plan.
Right.
Which they changed the like window from of how long you can like renew those last year. And everything that we keep hearing says that that's going to change to be longer again.
Oh, okay.
Where it's like a 12-month period instead of like a little 3-month guy, and then you have to renew it. And hopefully you don't have anything that pops up in those 3 months because then your underwriting, you're not going to be able to get through.
Dang.
So that's the struggle. And then if they can afford the plan, like it's not crazy on premium, here's your horrible coverage.
You have a $9,000 deductible.
Yeah. So it's like, again, how are we going to hit that deductible really quick?
Yeah.
Getting admitted to the hospital.
Yep.
And I'm seeing the ACA and hospital indemnity plans on that side being paired together as well. Hospital indemnity is going crazy this year.
That's good.
Across the board.
Yeah.
Like, I got high deductible plans that I'm talking to people about. Medicare Advantage plans. I'm like, slap one of those on every single one of those. Especially as we keep watching plans getting worse on those kind of coverages.
Yep.
Like, get them a couple days, 2-3 days at a high dollar amount. And like, you're going to be mostly covered.
Right.
I can't say 4 or 5 years from now, you're going to be fully covered on every day, but. And then ACA plans is, like you said, here's your $9,000 deductible with a $20 million out of pocket or max out of pocket. Like, it's just unreal. So like, unless they're getting some subsidies in place, which there's no solution for, these are the options people are given. And a lot of people, unfortunately, are opting just out. They're just saying, cool.
It's going to be uninsured.
Yeah. And that's not the greatest solution.
No.
As people in the insurance industry, we know how quickly that can be a horrible decision.
Yep.
But sometimes people their hands are getting forced.
I don't know enough about ACA. And we have 2 gentlemen in our office who do ACAs, and I feel like they're trying to get out of doing them. They must not pay, right?
I think there's still commissions on them. I don't know how well they are. I don't do a ton with them either on those plans. I just hear what a lot of agents are working with. And then they've pulled them before. They've pulled commissions all across the board on that. And so it's like, just how quickly can they pull the plug on this again? And
oh, gosh.
It's just scary. Like, it's just not a stable situation right now. Same with, like, B&C. Like, insurance just doesn't feel like it's in a super great place for how freaking necessary you are, all of you are.
Yeah.
Like, y'all need to be taken care of. Like, from the outside looking in, it's like, Kari's taking care of my grandma out there, like she's making sure grandma's got coverage. She's making sure grandma gets her pills.
I still have people try to pay me, and I'm like, I can't.
Can they pay you in pies? Is that a thing? Because you should ask, like, you can't pay me, but I'll take a pie.
I've had cookies.
There it is. Government, get her. Whoop, 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 whoop. Get her.
They were technically for my girls, not me.
Yeah, okay.
Yeah, they were for my girls.
So just have them pay your girls, right?
Yeah. Legal.
But no, like it's just like from the bottom of my heart, I know how valuable you guys are.
Thank you.
I see my dad, he's 76. He goes to the hospital. He's on a high deductible plan. And I've tried to convince this man for 3 or 4 years to get a hospital indemnity plan while he's still guaranteed issue. He can still get one, even though he's got COPD. He's got diabetes. He goes to the doctor freaking every year, it seems like. I might be HIPAA-ing out of the butt here, but like, bro, you are who would benefit the most. Like, a hospital indemnity carrier would hate to see his application come through, but guess what? Too bad, guaranteed issue because y'all said so.
Dang.
Like, I've been on him.
Keep pushing.
And I push you. I push my dad. I could push everybody. If anyone's listening, hospital indemnity. And then, for the love of all things holy, I'm going to throw it out there again, cancer insurance. Just like anything you can do to get these people covered because their coverage is getting worse everywhere. Yeah.
Agreed.
Yeah. I don't have much more. I think I got on my soapbox for a minute.
I don't
I'll get
either.
down.
I think we had a great cafe today.
Okay, let's talk about the mustache.
Hold on. Remember, I have a call.
You have a call. Okay, hold on.
You got 3 minutes to talk about your mustache.
Okay, here we go, guys. You can log out if you want to. I'm going to talk about my mustache for a minute here. I watched Top Gun Maverick.
Okay.
Miles Teller. Let me just tell you, that man is a drink of coffee, whatever the people say about men being attractive, because he is good
of tall
looking.
water?
Yeah.
Or wait.
I don't know.
A tall glass of water?
Yeah, something like that. Somebody in the
glass of
chat
water.
hit me up with what an attractive man is called.
Tall glass of water.
Because I've never heard it. But, so he had the mustache. And I was like, cool. So that's like what a good looking mustache is supposed to look like.
Yep.
He's over here rocking the piano, playing on Top Gun, driving a fighter pilot jet. And I'm here at my desk with a mustache, and I'm like, I'm not worthy of this mustache.
Yes, you are.
Not worth. I'm just I'm just raising money for people with cancer and trying to do things good for the universe.
Way more important than Miles Teller.
I think flying a fighter pilot and doing those things and like me raising money for cancer,
equal.
Same thing.
Same thing.
Same thing. But, I just have to look like this.
I think you're going to miss it in
that.
December. I think you need to keep it.
I won't. I got my hair cut, and, like, I had the whole slick back thingy, and I had a big old beard, and I was like, I look great. This is amazing. And then she was ready to cut my beard off, and she goes, are you sure? And I said, unfortunately, I'm positive. Shave it off. I mean, the big bushy beard just gone. And
get that man.
Say hello to my chin, and then you'll never see it again until November next year. Get that man in a plane. Sean, I'm on a jet. We're going to go right now. See you guys. So what's the thing you started? I know the middle part.
Until next time, have fun.
Make money.
And give impeccable service.
Like you guys are.